Welcome back. It's still the conversation, and we have a special guest here with us. Currently in Lagos State, we are experiencing a significant cholera outbreak, and the state has reported about 500 suspected cases as at today. Meanwhile, the Lagos State government has implemented various interventions to control the situation, leading to a reduction in cases in some areas. But the Lagos Island accounts for the highest number of cases. Meanwhile, residents have been advised to practice good hygiene, which means wash your hands, prepare your food in clean areas, and of course, watch what you drink as per water. Having this conversation with us today is the Special Advisor to Governor Babajide Sanwo-Olu on Health, Dr. Kemi Ogunyemi. She's here to give us an update of the cholera outbreak in Lagos. You're welcome.
Thank you.
So what's the current status of the cholera outbreak right now in Lagos?
Okay, so it all started around the 9th, 10th, 11th, where we had an upsurge. And we reported, the first report we gave was 350 cases. Right now, just to let you know, we are having a case conference at 2 o'clock where you find the exact figures, diagrams, and a more in-depth update. But for right now, we have just over 550 cases. By 12 o'clock, we're going to get an update on the data, because continuously we're getting, when we get the reports, we put them in a system and then we know how many. So just to be accurate, I can just tell you that it's over 550 right now. However, sensitization is going around all over Lagos, day and night, even over the weekend, the marketplaces, the churches, the mosques, everywhere, to let people know preventive measures and what they need to do to prevent them from getting cholera.
Okay. I want a clarification with the 550 cases. Have they been confirmed to be cholera?
So there's a difference. So there's confirmed. Confirmed means we sent the stool specimen to the lab. So a lot of them are still waiting results. However, when people present with certain symptoms, you can assume that it is cholera. Okay. But you do also have to confirm.
Okay.
Yes.
So do we know the cause yet?
Yes, we do. So the ones we have tested, we found out that obviously cholera is waterborne. And I must add that cholera has never left Lagos. It's one of those endemic diseases that people get it, but it goes up during the rainy season, like now, where we are now. Okay. So it's not a new disease to the state or to the country at large. However, the samples have shown that it is cholera. Some of the specimens that we've analyzed, we've actually established that it's a cholera type. It's a subtype 01, and it is deadly. It is fast. It's contagious, obviously, and so we know exactly what we're dealing with.
Okay.
Yes.
Earlier during the weekend, there was also a report that Tigernut drink was the cause of it. Can you confirm that?
No, I can't confirm that it is. I can't confirm that it's Tigernut. So what happened was, when we first saw the surge in the numbers of people with cholera, there was a common denominator. About 10, 12 people actually said they had Tigernut drink. So, you know, when you go to the hospital, the doctor or the nurse will ask you, you're presenting complaints. What did you eat last? Especially when you come in complain of vomiting and diarrhea. What did you eat? Where did you drink water from? What do you think you ate that might have caused this? And that's why quite a few of them said they had Tigernut. Hence hence we had to look into Tigernut and get it tested. We should get results today. We've got samples of Tigernut. So it's not that we're confirming that, oh yeah, Tigernut caused cholera. Tigernut itself will not cause diarrhea, even if it's the cause. It's the water that is used. It's the way it's prepared. It's the people that prepare it. It's where it's been prepared. It's the environment it's been prepared in. So until we confirm that it is Tigernut, right now it's not. It's just that people have said that's what they drank before they had the symptoms.
Okay. In terms of sensitization and awareness, and the report also shows that it is prevalent in Etiosa, is it Tiosa or Lagos Island? No.
Lagos Island.
Lagos Island.
So it started off with Lagos Island having the high. So there was all the, those local government areas. That's where we saw a lot of cases being reported. So it was Lagos Island, Kosofe, Etiosa, and then it went on and on like that. But right now I can tell you that all the local government areas have had one or two cases. So there's no local government that's been spared from it. But the numbers are going down. Gradually. So that upsurge is right up here where we're here. And we expected it to go up during the Elia festival because when people gather together, there's a lot of cooking of food. And if people use contaminated water, that's what happens. And we saw that. We saw the upsurge. And then we're now getting it coming downward. It's not gone up to where it was at the beginning when we alerted the public. Okay. So I can say that it's coming down. Okay.
Abimbola has a question for you.
Yes. You did say that cholera is one of those endemic diseases that never leave. So they're always here. It's always here with us. And, of course, we just need to step up awareness. Can you also take us through other ministries or collaborating agencies that are with you on this? We do know this is not just an advocacy by the Ministry of Health. So please take us through other agencies that are working with you on this.
So absolutely, yes. And, you know, we call it the One Health family. Okay. So we have the Ministry of Environment. They're key to this because it's an environmental issue as well. So we've been working hand in hand with them. And we've also been working with the Ministry of Education. They have a quality assurance network where they find out what's going on, and then they can alert the doctors, the teachers, and the students as well in terms of public health education. We're also working with agriculture because it's about food. And all the other agencies that actually feed into communities and the environment. Absolutely.
So, Guyami, I would just like to know, for those who are watching right now, what are those signs that would say or tell if somebody is battling with cholera, and what kind of engagement are you having at the grassroots to sensitize Lagosians? We all know that their sanitation and, of course, hygiene is quite poor at the grassroots level.
Thank you, Ajibola. So, yes, so signs and symptoms which we're telling the community is, the first thing is usually people complain of abdominal pain, and then you have watery diarrhea many times during the day, and then you have vomiting. What we found in our latest data is that all the patients, the people that are coming into the hospital right now are actually complaining of diarrhea and vomiting. So some people will complain of diarrhea, no vomiting. Okay. But now what we're seeing is that they're having the vomiting as well. There's also muscle pain, because when you're vomiting and you're losing a lot of fluids, you're also losing a lot of electrolytes. So this affects your muscles, so people complain of muscle cramps. There may or may not be fever. Generalized malaise, just feeling tired. And of course, some people also have bloody stool, because it's in the small intestine, so they might complain of bloody stool. But the most common, the one that, you know, just come into the hospital, even if it's not cholera, at least you can rule that out, is watery diarrhea and vomiting.
Okay. Lagos State is a place where we're always having parties. It doesn't have to be during the festive seasons, and we have a lot of food vendors. What is the state government doing towards sensitizing them on how they handle food?
So I didn't answer. Sorry. I just realized I didn't answer the second part of Jibola's question, which is what are we doing in the community? And so, like I said, the environmental health officers, both at the primary healthcare level and, of course, at the Ministry of Health, are going around everywhere, basically, especially those areas that are hardest hit. They're going to the marketplaces, and we're telling people that this is with us, and this is what they need to do. Prevention is better than cure. Would rather people not have it and do all the things they need to do, like hand washing and ensuring that the environment is clean, and covering, their food, washing fruits, rather than just pick it up and eat. But most important thing, washing your hands very well, and don't eat raw food. Some people like sushi, some people don't cook their foods properly, but you should cook your meals very well and ensure you can boil your water, cover it, and that's just basically it. We're going to the churches. Obviously, the schools are also, the teachers have been sensitized. Health agencies like the NMA, Nigerian Medical Association, the Nursing Associations, Medical Lab, they've also been sensitized, and everybody's going out there in the community and telling them what to do and what not to do. We've also provided chlorine tablets that you can put in 1 part to 100 parts of water that would clear and clean out the water. And in answer to your question about food handlers, they're key. They are key to this. So even in the schools, all the people around that area that sell all your mama puts and all the people, it's like you've got to wash your hands. We've got right into the marketplaces and the people carrying water in the cans, kegs. We've told them, even the men washing the raw meat, they use water to clean the area. Just ensure that the water is clean. Ensure that you're getting it from clean sources. And then one thing we've also noticed, and this is from the environment, is that we've noticed that some people they have their boreholes right beside their sewers. It is a no-no. There's actually law that says there's a certain distance it must be, and we found in going around that they're too close. It's just too close to where your source of water. So people have been encouraged to please move the boreholes and just general things like that, so that we can keep flies away into the water. And obviously, one of the most important things that I'm sure you've seen people do is defecating publicly. And so that is a problem. It's a big problem in Lagos, and we're working hard. The governor is working hard to ensure that for the environment, we actually give people good source of access to good water. And not only that, providing mobile toilets so that people don't have any excuse, because it's a rainy season. So just imagine, all you have to do is imagine it. Somebody has defecated by the roadside. There's bad rain like we had 2 days ago. It washes all that into an open system where wells that people still use, and boreholes. It can just go in there. And then, you've got environmental factors like climate change. There's flooding virtually everywhere. And I must also point out that the WHO has released that it's actually not only Nigeria. There's actually an increase in cholera around the world, absolutely. We're just, because we live here, that's where it concerns us. But there have been a lot, thousands of infected people across the world. So it's not just in Nigeria. I know some people say, why Nigeria? That we know this is going to happen, but no, it's actually one of those things, and WHO is taking them. Yes.
Yeah, Dr. Bunyami, just to stay on the grassroots awareness here, again, we do know that there are sanitation officers at the local government level. And so what would also be their role here, especially with what you've mentioned, where there's no proximity between where the water borehole has been sited and where the soakaways are? And perhaps are we also going to go a step further by prosecuting people in this particular situation? Because oftentimes you realize that when people are left off the hook, they take things for granted and put the lives of others in jeopardy. So what exactly would we be looking at here, talking about what the sanitation officers should also be stepping up on?
Yes, thank you. And they have stepped up, especially, I know it's because we have an outbreak, but it's continuously, so there's more emphasis on things like that. So they are going around, and people, there's a building code. So when people do not, we are going to ensure that sanctions are given to people who do not obey the simple building codes. So as they go around, they're noting the areas. Now, Lagos is densely and overpopulated. I mean, that is, to say the least. It is overpopulated. How many places can we go in a day or even in a week? So the best we can do is just ensure that during the time we're going around, we're making sure, they're making sure, and they're really working, rain or shine, because like you said, it's for everybody. It's for everybody. You may live somewhere where you have good water supply and all that, but then maybe your house help, somebody, your gardener, anybody that comes to your house to help you in your household may be coming from somewhere wherever the landlord has built the borehole near the sewer drainage. So they're going around and we're telling people and we're looking and we're telling them, move this, move that. So that's ongoing. That's a job on its own with the building code. But ensuring that when people are building, even moving along now, when people are building, they're building according